Hello everyone, and welcome again to CB Clips. In this CB Clips episode, I would like to cover two clinical principles that deal with thyroglossal duct cysts. Most of you came to the conclusion that this young woman who had an abscess drained in the neck and had not healed and essentially became a fistula had a thyroglossal duct cyst, and that's correct. The two principles I'd like to cover are this. Number one, how do these fistulas develop? Well, thyroglossal duct cysts can fistulize to the skin. It is possible that they rupture into the skin surface, but most of the time they present with what we think is an abscess, as you see in this picture, and usually a surgeon will incise and drain that, and that converts it into a fistula. But in fact, most of these inflammatory lesions are cold abscesses or simple perforations or ruptures of the cyst into the soft tissue. So they really don't need to be drained, and most of these patients will not have a fever, will not have infectious symptoms, and really should go on to have a cyst shrunk procedure. The second principle, which again several people commented, is the desire to do an ultrasound. Now, it's fine to do an ultrasound. I don't have anything against it. It's a non-invasive test. But the question we should ask ourselves is why? An ultrasound will typically not show you the tract. It really cannot definitively differentiate a thyroglossal duct cyst, for example, from a dermoid cyst. And the one pet peeve I have is when people say that, well, I want to make sure that this isn't only thyroid tissue. Now, you have to look at the literature, and actually the literature is on this is summarized in this letter to the editor that I published in JPS a couple years back, and really the literature does not support that premise. If the only thyroid tissue is in a thyroglossal duct cyst, that patient will present with hypothyroidism long before they ever have a thyroglossal duct cyst. So ultrasound should be used selectively. The diagnosis of a thyroglossal duct cyst, whether complicated or not, really is a clinical one, and you can use ultrasound as an adjunct if needed in particular cases where things may not be clear. Thank you so much, and until another episode of CB Clips.